Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Potency of inhalational agents. The potency of inhalational agents is directly proportional to the lipid solubility according to Mayer-Overton rule. Minimum alveolar concentration. Minimum alveolar concentration is the indicator of potency. So minimum alveolar concentration is defined as the minimum concentration which is required to produce immobility in 50% of subjects given painful stimulus. So you have given painful stimulus in all the people after giving anesthesia, and if 50% of subjects produce immobility at a minimum concentration, that is called as minimum alveolar concentration. Minimum alveolar concentration can also be written as MAC 50 or MAC immobility. Minimum alveolar concentration 95, that is MAC 95, means the minimum concentration required to produce immobility in 95% of patients after giving a heavy painful stimulus. On giving painful stimulus. So that is minimum alveolar concentration 95. Minimum alveolar concentration 95 equals to 1.3 minimum alveolar concentration. Most potent minimum alveolar concentration, so minimum alveolar concentration tells us about the potency. So most potent and inhalational agent is, overall it is methoxyfurfuran, but it is not used now. So current use is halothane. Least potent overall is nitrous oxide, whereas the least potent volatile agent is desflurane.
So agents and their minimum alveolar concentration. Halothane has minimum alveolar concentration of 0.75. Isoflurane has a minimum alveolar concentration of 1 to 1.3. Sevoflurane has a minimum alveolar concentration of 2, whereas desflurane has minimum alveolar concentration of 6. Whereas nitrous oxide has minimum alveolar concentration of 104. So least potent is nitrous oxide because of high minimum alveolar concentration. Minimum alveolar concentration is inversely proportional to the potency. That means the least potent here is nitrous oxide, which is 104 minimum alveolar concentration, whereas highest potent is halothane, which has least minimum alveolar concentration.
Factors affecting the minimum alveolar concentration. First, factors increasing the minimum alveolar concentration. Age. Minimum alveolar concentration is maximum in infants, that is from peak to the 6 months, followed by neonates, and then it is less in adults. Minimum alveolar concentration is decreased. Temperature like hypothermia or hyperthermia up to 42 degrees Celsius will decrease the minimum alveolar concentration. If there is severe anemia, severe hypoxia, severe hypercarbia will decrease the minimum alveolar concentration. Alcohol, that is acute alcohol intake or acute drug abuse, will decrease the minimum alveolar concentration. Then pregnancy or IV anesthetics or local anesthetics except cocaine will decrease the minimum alveolar concentration. Electrolyte imbalances like hyponatremia, hypercalcemia, and hypermagnesemia will also decrease minimum alveolar concentration. Factors increasing minimum alveolar concentration. Factors increasing minimum alveolar concentration are hyperthermia more than 42 degrees increases minimum alveolar concentration, chronic alcohol, chronic drug abuse except cocaine and ephedrine, so these will increase the minimum alveolar concentration. Barometric pressure causes pressure reversal theory of anesthesia or hypernatremia. So all these factors will increase the minimum alveolar concentration.
Summary: minimum alveolar concentration uh, will tell us about the potency. So minimum alveolar concentration 50% is the concentration which is required to immobilize 50% of the patients on painful stimulus. So it is MAC 50 or MAC immobility. Then MAC 95 is around 1.3 times the minimum alveolar concentration. So overall, most potent is methoxyfluorine and halothane. Halothane is used currently, but methoxyfluorine is not used. Whereas least potent is nitrous oxide. Least potent volatile agent is desflurane. So agent and the minimum alveolar concentration, if you see, halothane is 0.75, isoflurane 1 to 1.3, sevoflurane 2, desflurane 6, and nitrous oxide 104. Minimum alveolar concentration is inversely proportional to potency. That means more the minimum alveolar concentration, lesser is the potency. So nitrous oxide is least potent, and here halothane as most potent because of increased minimum alveolar concentration. Factors affecting minimum alveolar concentration. Factors decreasing minimum alveolar concentration are: adults have least minimum alveolar concentration more than infant, neonates, and more for infants. Minimum alveolar concentration is decreased in hypothermia and hyperthermia up to 42 degrees Celsius, hypoxia, hypercarbia, and anemia. Acute alcohol intake or acute drug abuse, it is decreased. Then, if minimum alveolar concentration is also decreased in pregnancy, IV anesthetics, or electrolyte imbalances like hyponatremia, hypercalcemia, and hypermagnesemia. It is increased. Factors increasing minimum alveolar concentration are hyperthermia more than 42 degrees, chronic alcohol abuse, chronic drug abuse, and hypernatremia, and also barometric pressures.
Thank you and thank you for watching.